The eyes don't see what the mind don't know, right? So once I knew this, wow, I could see it. I could see it everywhere. And so part of my practice has been optimizing these major hormones so that, menstrual cycles go normal again and fertility improve. I've had clients in menopause who started their periods again. And that was the case for me. I became pregnant naturally at 41 after failing hormonal therapies and hormonal treatment.
Hi, and welcome back to the Wellbe podcast, a weekly series designed to help you learn, expand what you thought was possible, and become as empowered as you can possibly be in your health. I'm your host, Nolan-Smith, a board-certified holistic patient advocate and the founder of Wellbe. And today I'm bringing you a brand new episode with Dr. Anna Cabeca, a best-selling author and triple board-certified holistic Ob-Gyn. The episode is all about healthy female wellness, fertility and infertility, having a holistic pregnancy and postpartum recovery, how to holistically freeze your eggs and do IVF, and we even touch on perimenopause and early menopause. Before we jump in, I want to give a shout out to Liz F., who wrote in a review of the podcast, "Thank you so much for your hard work. The podcast, the website, blog posts, and your library of fantastic tools and info. You are so incredible." I swear I did not make up this glowing review. Liz is a fantastic person who has taken a few of the Wellbe programs, including the Spark Health program. So Liz, thank you so much for writing this review. I'm so incredibly touched by your kind words. They mean more to me than you know. If you're listening, email hello@getwellbe.com and my team is going to send you a special gift in gratitude for leaving a review of the podcast and for such sweet words. If you want a shout out from me or a chance to win a gift from Wellbe, make sure you leave a review wherever you listen to podcasts. You don't even have to stop listening to this episode. Just scroll all the way down on our podcast page in your app and click Write a Review. Give the Wellbe podcast a few stars and a few words, and then press Submit in the top right-hand corner. It's super fast and easy, but actually very important for any podcast, so thank you for doing that now. All right, now some of you may know I'm currently 7.5 months pregnant with my first child, a boy, so my mind is more focused than usual on healthy, natural reproduction, and that very much includes a woman's hormonal health from when she first gets her period in her preteen years until she has her first pregnancy, even if that's 20 or 30 years later, and that continues through to when she ends her period, also known as menopause. My conversation with Dr. Cabeca was not only incredibly informative, but also so inspirational. This woman went through so much herself with personal tragedy and infertility, which eventually led her to choose a different, more holistic way to practice gynecology and obstetrics because she saw what actually worked. She's helped so many women and families through irregular periods and other hormonal conditions, as well as infertility, having holistic, successful pregnancies and postpartum recoveries, and through early menopause. Oh, and did I mention she also has 4 children? She's amazing, and you're going to love her. Here is Dr. Anna Cabeca. Anna, thank you so much for being here.
It is great to be here with you, Adrienne. Thanks for having me.
I'm so excited for this interview in particular because I'm pregnant and the time is getting closer and closer to when I'm going to have to think about the actual birth. I've sort of been blocking it out, but it's such an amazing 9 months. And the last, 6.5 for me, many people have spoken to me about their fertility issues and their pregnancies and their births. And obviously I'm researching myself, what I want mine to be like, what can they be like, what should I be worried about, all these things. So I've been wanting to have a conversation with, sort of more functional OBGYN. And then, a lot of people have also spoken to me about perimenopause or going into early menopause and what, that experience is like if it was kind of very early and they were still thinking about having children and things like that. So there's a way that that's linked to fertility as well. And I know that's a big focus for you. So we'll dive into all of that. But first, let's start with kind of I shouldn't even say the beginning because it starts way before this, but let's just say let's start with fertility as the beginning of some sort of pregnancy journey. In your experience, what have you seen to be the most common root causes of infertility? You know, if someone's trying to conceive, what are really the most important things she and her partner can do naturally to support fertility?
Yeah, and like you said, it starts way before thinking about becoming pregnant when we really have to start optimizing our fertility. And one thing is really optimizing your periods, starting with optimizing your period. So if you've been on birth control, you really don't know your period. So getting to know your natural cycle off birth control, off any hormones, it's really important. And if you're having PMS symptoms, if you have irregular bleeding or spotting, that's a sign that we've got to get our body, our hormones in sync, our uterus in sync with our hormones and our ovaries and everything, kind of just synchronize it. And the birth control pill for a couple months can kind of reset. But again, when we're on it long term, that can kind of disrupt our own connection with our natural hormonal flow. And when I see women that are struggling with PMS and irregular cycles or painful periods, that's a big red flag. And I want to address that right away, very holistically, naturally, through diet and lifestyle and maybe some supplements that we'll use just to kind of really balance things out once we understand what's going on. So I think that's really, first and foremost, getting in touch with. The second really big cause of infertility is male factor. We're seeing over 40% of infertility is because of, inadequate sperm production, motility issues with sperm, something related to the male factor. So we can address that too. And then ovarian resistance, just aging, can be a problem. And one thing we call a luteal phase defect means a shorter than optimal second half of your cycle post ovulation. So if that's shorter, or we don't have enough progesterone, it's harder to maintain an implanted fertilized egg. So that can be an issue too. And then I'm going to throw in stress. Stress is a huge infertility factor for sure, both male and female.
So I was just going to say, I've heard a few of the ones you mentioned, and stress was definitely a part of that. Can you explain, I know how complicated it is, but as, a quick, simple explanation, if there is one, of like how exactly stress impacts? Because I know, cortisol is a stress hormone, and there's a lot of hormonal things going on to get pregnant. So I assume it's in there, but would you mind elaborating on that a little bit?
Yeah, and I know this firsthand from my own experience. So when I was 39, and I'd been an OB-GYN for over a decade at that point. Oh my gosh, more than a decade. And I was diagnosed with early infertility and early menopause. I failed the highest doses of infertility treatments and was told I would never be able to have another child. And that was, I was grief stricken with that information. Here I'd helped thousands of women, couples conceive healthy pregnancies. I did fertility treatments. I was specialist solo OB-GYN, so I took care of the needs of my patients. It was just one of those things that really had devastated me, and it took me on a journey around the world for healing. And that's one of the reasons why there's many different tools in my doctor's bag than many of my colleagues. And it was this firsthand experience. But for me, that reason, looking back, because I didn't know at the time, we're not taught this in med school and even OB-GYN residency. We're like, oh yeah, there's stress issues, get a massage, whatever, but really what's happening? And for me, it was an early infertility, right? Early menopause. It blew my mind. And what happens is when we are stressed, I had post-traumatic stress. We had a major tragedy in our family, and from that, just that chronic fear, chronic stress is something else going to happen, right? We've lived through a pandemic. We think, oh my gosh, there's chronic everyday stress. So whether it was a traumatic stress or chronic everyday stress, what happens is cortisol keeps getting pumped out. And when cortisol goes up, cortisol is manufactured from one of our key reproductive hormones, our mother hormone called progesterone. So consider progestation. It is to support fertility. Progesterone is predominant in the second half of our menstrual cycle post-ovulation. So it's kind of the hormone that makes the bed essentially in the uterus for the embryo to implant. So that's progesterone. And cortisol is made from progesterone, downstream from progesterone. So when we're having to make cortisol, progesterone goes down. And with that, all the other hormones that are downstream from there, and that includes estrogen, DHEA, and testosterone, are reproductive hormones, are hormones of sexual desire, are hormones of fertility, are hormones, of pregnancy. So all of those get depleted to sacrifice to make this life-saving hormone cortisol. But when cortisol is going on for too long, you get this significant depletion. And in my case, it became infertility. So I always say, and I teach this, and I've taught residents and other physicians around the world, but the eyes don't see what the mind don't know. Right. So once I knew this, wow, I could see it. I could see it everywhere. And so part of my practice has been optimizing these major hormones so that, menstrual cycles go normal again and fertility improve. I've had clients in menopause who started their periods again. And that was the case for me. I became pregnant naturally at 41 after failing hormonal therapies and hormonal treatment. So reversed menopause for another decade. I write about it in my book, The Hormone Fix, and I really do recommend the stress chapter, which is chapter 8. It's for everyone because we all have stress. Understanding how your body responds and how that manifests in our social interactions and our interpersonal interactions, our relationships, our energy. It's really powerful, powerful information.
I want to back up and say I normally start interviews asking people how they kind of became, if you're conventionally trained, how you became interested in the functional holistic world. This is one of the few I've ever done where that wasn't the first question. So I'm so glad that you mentioned this personal experience you had, because I think almost everybody who's been on the show, who's an expert and conventionally trained the way that you were, you had something happen and your eyes were open, and it's usually related to personal or family something. And then you went and got this additional training in functional medicine, this other way of looking at your body and healing. And so I appreciate you sharing that so much. And also I'm very sorry to hear about whatever the, traumatic event was that launched the PTSD. But I know that there's women, like you said, whether it's a traumatic acute event or this just long time chronic stress where they've been on autopilot in a stressful mode for so long that they don't even realize. I think you said your eyes can't see what your mind don't know. They don't even realize that there's another way of living that isn't producing this much cortisol every day. Yeah. But I was so happy you also explained the mechanics of how cortisol and progesterone and fertility interact, because it's so clear now. Once you explain it, it's like, duh, of course, if it's spiking too much and I'm not making enough progesterone, then how could I get pregnant? So I love all of that. Thank you. I remember when I asked my OBGYN several years before I got pregnant, I saw these, ads for these pregnancy testing, these direct to consumer, really beautifully packaged tests, find out about your fertility. And I asked her, should I do one of those? Is there a test you could give me? I'm curious, what's my fertility? And she said, do you get regular periods? I said, yes. And she said, okay, well, that's about as good as we need it to, there are definitely cases of women getting pregnant without a regular period or who have a regular period and still can't. But overall, it seems that that's the best way to, understand your fertility and optimize it is optimizing that process first.
Yeah, that's so true. And I think that with that, understanding your period, getting to know your period, knowing when you ovulate, knowing your cervical mucus, how you can tell the changes to your cervical mucus to show that you have ovulated, you won't see that on the birth control pill. So you've really got to get off the birth control pill to optimize, to really get in touch with that.
I could spend an entire interview talking with you about the birth control pill and how much I don't support it. And, I had experiences with amenorrhea in college where I didn't get my period for, I think it was 2 or 3 years. And it was very unusual and strange. And this really was one of the 3 major events in my life that got me interested in what we're doing now and healing the body holistically and understanding root causes. And it was recommended to me by almost every OBGYN or endocrinologist I saw that I take the birth control pill. And I'm so glad I listened to my intuition to say, that's going to cover it up. Like, I want to
Exactly. That's
understand what's
masking.
going on, you know?
Mhm.
And luckily I did. I ended up working with more of a holistic nutritionist who helped me in a variety of ways with herbs and acupuncture and supplements and diet change. And I was able to restore it after 6 months of working with her. And it's been completely normal as far as coming, you know, around every 30 days, lasting about 6 days since I was 20. But I have so many friends who were on the birth control for a very long time and then only went off to get pregnant, only to discover under the hood these other issues. And then it took a very long time to get pregnant, or it was a very expensive journey similar to yours, where they had to then quickly switch into, you know, synthetic hormone or IVF mode or something like that. So that leads me to my next question for you, which is, I've had a lot of questions from the WellBe community about freezing eggs and IVF and feeling like they know these hormones are synthetic and they don't really want them in their body. But they're also at a certain age or having certain issues where they feel like they have no choice but to do that. And they're asking me, is there a natural way to do egg freezing or IVF, or are there long-term hormonal implications or impacts to doing that? You know, either the egg freezing or IVF, which seems to be about the same process, and just, you know, wanting to know if there's anything they can do to make it more natural, or should they avoid it? And I really don't know enough about this topic in that area. So I thought you would be a great source of information on it.
You know, and I've counseled many women too. They're like, I don't know, you know, if I am going to be able to, or when we're going to have babies. And I feel like I'm drawn to freezing my eggs. And I think that's definitely a personal decision. I mean, it's a quick process and it's hormonal health for a couple months, right? But your body will recover from that. So I would say prepare your body prepare your body as much as possible beforehand. So like optimizing your diet and nutrition. For me, it's all about getting like a very healthy keto green diet. And that's something I write about in my books, the keto green diet. So breaking up with sugar, intermittent fasting, no snacking, hydrating between meals, not with meals. I mean, these are key principles, diet and lifestyles, to manage our major hormones. And that will really help your cycle. And, you know, supplement as needed, you know, fish oils, make sure your vitamin D, iodine levels are all healthy, thyroid's healthy. But for reasons like, you know, concerns for cancer, delayed childbearing, freezing eggs is a viable option. And it's also, you know, it's a safety net. You don't have to use them. It's, you know, it's a different feeling than if you have, you know, frozen embryos, right? But with frozen eggs, you have that ability. And hormonally, you know, the process to increase the number of eggs that are formed during that time. So the extra hormones that we're injecting essentially to help you do that, it's, you know, they flush out of your system, you know, by the next menstrual cycle. And then again, keeping up with additional detoxifying herbs and supplements will help you clear that and regain your healthy period. Anyway, so if you're freezing eggs because family history of cancer, you know, concern for delayed childbearing, whatever your personal reasons are, you can feel rest assured that, you know, as long as you're focusing on healthy diet, nutrition, lifestyle, using herbs and supplements to help detox the hormones after the fact, you're going to do great. You're going to do great. And that's a kind of a peace of mind process for many women as they're, you know, wanting to delay childbearing into their late 40s, 50s. And well, I don't know about 50s, but I do have one 49-year-old with twins right now. So we have
Janet Jackson. Remember, she was 51, I think, when she had a baby.
Oh my gosh, right? It's, you know, 41 was my upper limit for sure. So I have another friend, 45, with twins, and IVF, you know, had done in vitro fertilization and sperm donation, and a single mom in New York City at 45, pregnant with twins. She had 7 rounds of failed IVF. Then I started working with her. She worked with me and an acupuncturist. Her last 3 embryos, you know, and failed 7 rounds. So her 8th round, she conceived twins, 2 healthy baby boys now. So living in New York City, they're 3 years old. So, I mean, that's like the difference when we're able to optimize our body. We can, I mean, statistic wise, you know, the chance of those 3 taking when the healthiest and best, did not, but they're perfect, just perfect, right? Just
Wow.
perfect. So
That's
preparing
beautiful.
your body for IVF too, whatever your personal decisions are. And I always tell clients, like what you did, listen to your intuition, that small voice inside of you. What are you visualizing? What's in your future? What are you visualizing? What do you want for yourself? Trust your intuition, pray about it, fast for 3 days and pray so you can be really clear in this decision-making process, because it is a commitment.
I love that you mentioned fasting and praying, because I did an interview on circadian and intermittent fasting. And then I just did a investigative guide that was also a podcast episode all about the science and research behind prayer and spirituality and what does exist on it. The short answer is not that much, but what's out there is just fascinating, and how it plays such a role in healing anything, whether that's infertility or, cancer or other kinds of chronic diseases. So I'm glad you mentioned that as well. So it sounds like, talking about IVF and egg freezing, that it's not so much that women could find a more natural version of a synthetic hormone. Like, a synthetic hormone is just synthetic, right? It's not natural, but rather that they can do a lot to support their hormones with their diet and lifestyle, such that they won't need as many rounds, or that what they want to happen will happen, and that they can use herbs and supplements to then detox out these synthetic hormones and any lingering effects they might have after they don't, need them anymore, or to sort of rebalance. So is that sort of accurate?
Yeah, absolutely. Because the goal is to get a number of viable options, right? A number of viable eggs. And with, natural estrogen and progesterone and the modalities that we have today, we could maybe get 2 or 3, but, really want to harvest at least 8, 8 to 10, because it just, over time, some just don't make it. So it's an invasive procedure. It's a commitment. So considering that, but being as healthy as possible, when you're going into it to begin with.
That makes a lot of sense. And so you mentioned, actually, in your description of what the woman who was in New York City did with you, and also with an acupuncturist, switching gears a little bit, when people actually are able to then conceive, whether that's, through IVF or naturally, how can women navigate having as natural a pregnancy as possible? Because now that I'm going through it, I am doing a lot for myself on the natural side, but I'm also seeing, with my interactions with the healthcare system, all these opportunities to do things that are not as natural throughout the pregnancy. And many OBGYNs who mention almost nothing about what you're supposed to be doing for your body besides, maybe limiting high mercury fish and soft cheeses and things like that. But, other than that, really nothing, which shocked me. I thought I was going to get a packet of things that I should be eating and not eating, and potential supplements and, things to be doing all day, and sunscreens that I couldn't have, and all this stuff. And really, no, it's up to your own kind of research. And there's many different sources. So that was very eye-opening for me. But how can women have as natural a pregnancy as possible? And are there certain, treatments or modalities that you think really support natural pregnancy, like a acupuncture or chiropractic care or something like that?
Yeah, definitely. I have so much to say on this topic, right? So I've had 4 pregnancies in my life, right? I've delivered 4 big babies, and, it's been an entire journey for me. And there's so much that I want to tell women as an OBGYN going into labor and delivery. I mean, but in pregnancy, I had handouts, and I created this little booklet that I would give my patients for each trimester as you go through it, or each month as you're going through the pregnancy. There's different stages that I really want you to know. So I would try to hit on just the top 5, try to think of what my top 5 would be for patients. The first one that is always, you want to maintain your nutrition and you want to avoid sugar. So, eating keto green lifestyle, good quality fats, healthy proteins, free range, grass fed, no pesticides, no herbicides, organic, healthy fish, things that you love and enjoy is important, but no sugar, like really avoiding sugar. And dairy, dairy is not good for us. It's not good for our babies in utero. There's lots of hormones in dairy, and we really want to rely on our own hormones too. So I'm big anti-dairy, especially for PCOSers and infertility and weight loss resistance and all that stuff. So none of my book, all my recipes are dairy free. There's always an option for some good, healthy feta cheese or something. But for the most part, it's no dairy.
I was just going to say, I try to avoid dairy myself for not any particular reason other than, like you said, it's a different mammal, and a lot of bad hormones and things end up in dairy, even organic grass-fed dairy, here and there. But feta cheese is it slips into some salads and things like that here and there.
Oh yeah. Yeah. I hear you on that one. So eating healthy and working with clients, diabetes in pregnancy, keto green living is very, very healthy. That nutrition, like say, for example, smoked salmon with capers on a bed of greens, or sauteed spinach drizzled with olive oil and lemon juice for breakfast, right? And for dinner, sauteed chicken with broccoli, cauliflower, some sliced carrots with olive oil, lemon juice. And, that's like a good keto green. Those are healthy keto green meals. And you're avoiding the bread, you're avoiding the grains, including rice and starch. Listen to your body in pregnancy. But when we give ourselves those starches, our blood sugar is really kind of sensitive. So we get these highs and lows, and we really want to keep our blood sugar really stable in pregnancy as much as possible so that we have a healthy baby who's metabolically strong and ready, because we know insulin resistance, diabetes creates already a metabolically challenged baby, and we don't want that. And again, I wish I knew in my first couple of pregnancies what I learned along the road. I was like, God has humbled me by teaching me life lessons outside of the textbooks. So that is really that diet and nutrition. I also supplement my clients with a very good high quality multivitamin and mineral. And there's a few different ones out there. There's a couple companies that I use typically for myself or my patients' products, and some that I've created. But a good multivitamin with methylated B vitamins, and that's important, plus a healthy, clean omega-3 fish oil, not your Costco omega-3 fish oil, one that's heavy metal tested and clean. And another supplement that's really good for brain development, and good studies on this, conditionally essential amino acid, is carnitine. And again, a clean source of carnitine. So I supplemented in my last 2 pregnancies with carnitine as I got more into research and understanding supplementation. Of course, we want our vitamin D high and healthy, so we want to optimize that as much as possible. And, natural iodine-rich food, which is essential for every hormone receptor. So like if we're not eating raw fish because we're pregnant and that we worry about that, but the nori leaves, the seaweed salads, things like that are very, very good for our thyroid. It's like, we don't have Hashimoto's or thyroiditis or something like that. So cleaning that up, that's number one, with, careful supplementation as number 2. And the third is do your pelvic floor exercises, do your Kegel exercises. I always tell my clients at pregnancy, okay, this is how you do your pelvic floor exercise. I've got a video now on my YouTube channel, but do your pelvic floor exercises, do it regularly, and you will do these until you die. So pelvic floor exercises and pelvic massage. So the muscles around the vagina that are just so flexible and dynamic, our uterus is able to expand to, carry more than a 12-pound baby, right? With twins, sometimes there's been, 16, 18 pounds in there. So the uterus is so able to expand, as well as the muscles and perineum. We want to keep that tissue and blood supply healthy, and healthy muscle increases healthy nerves and healthy blood vessels. So then your recovery postpartum is a lot better. So the pelvic floor exercises are important. And with that, exercising during your pregnancy, for me, yoga made a huge difference in being able to deliver natural childbirth. So doing yoga and, the position malasana, and really getting your flexibility optimized and just strong core muscle strength, because your abdomen is being stretched out. So being able to do that, pelvic floor exercises and good flexibility exercises, core muscle exercises during pregnancy is essential for healthy pregnancy and childbirth and beyond. And with that, understanding, what you want your birthing experience to be like, to really have a good visualization of what that birthing experience is. And so for me and my first child, I was like, I don't want to, I'd been an OB for not even a year at that point. or just over a year, and, had delivered many babies, but I didn't want an episiotomy. But this first child was over 8 pounds, and I had an anterior rip tear that teared around the urethra and up towards the clitoris. So, that hurt for over a year. That was terrible. As an OB, I then gave downward pressure into my deliveries. The OB that delivered me just let the child come out, but downward pressure, a posterior tear or rip, is much better than anterior, but also a small episiotomy is much better than any tear. So really understanding, like with your OB, downward pressure, if you need to make an episiotomy, we really want that downward pressure and controlled downward delivery of the head, makes all the difference in the world. I never delivered a baby who had an anterior tear. So for sure, like that makes a difference in my practice. Delivered over 500 babies, and I've never delivered one with an anterior tear. Let me tell you, experience is a great teacher. And so that's really a very powerful birthing experience. And do you want to walk? How long do you want to walk? And really communicate what you want your birthing experience to be, having a birthing advocate in for you. Because many people right now, because OBs, are busy, they're scheduled for an induction and scheduled for a cesarean section, and you don't have the birthing experience. You need that because oxytocin is essential for child attachment, for the entire process. If we have to have a scheduled C-section, okay, but we really want to do everything to increase oxytocin. So nipple stimulation, that's a really important physiologic experience that moms and babies need to have for bonding. So this whole childbirth experience, from episiotomy or no episiotomy, being able to walk and labor and not have your water broken, because once the water is broken, it is painful. I know this personally and from many, many, many deliveries, but it is really painful. So delaying that breaking of your water until it breaks on its own, or it's absolutely necessary to move labor along, and trusting the process of your body's own natural wisdom when it comes to delivering your baby, and not being feared into an early induction or cesarean section. Don't have to. And we watch very, very closely as OBs, but really communicating that and choosing an OB who has, maybe the lowest C-section rate in your community would be an optimal choice.
Yeah, I'm so glad you brought that up, because my next question for you is, how can women, especially with their first babies and first births like me, sniff out some of these myths or red flags that might indicate that an OBGYN is not going to really be catering to the exact needs of desires that a pregnant woman might have, or is going to kind of just do a lot of the standard of care stuff without thinking about whether it's all totally necessary and things like that. Because when I was choosing whether it was a doctor or midwife in the beginning, it was very hard to find any information about a particular OBGYN C-section rate, for example, or even a hospital C-section rate. It's really not advertised. And I knew I was in the right place with this boutique midwife practice I ended up going with, but I'm delivering at a hospital, but they work, in the hospital, when it was like right on their website. This is our C-section rate. This is the state of Connecticut C-section rate. This is kind of how we like to do things. And it was all about empowering the mother, and it felt very different. So I just, a couple of things like that. I have limited experience, but from your perspective, how can women really sniff out somebody who's going to be more natural and more empowering to them in this process, and prevent, a C-section and things like that if they can?
Yeah, definitely word of mouth, like talking to other moms, that have recently had a baby, and just really what was their experience. And also, as an OBGYN, I know that, like I will say, OB obstetrics is 95% joy, 5% sheer terror, even with the best plans, right? But that's a small fraction, and we're ready for it. But I think knowing, healthy pregnancy, you're on board, your partner's there with you, you've got a plan, you have visualization of what that looks like, you're fit, you're healthy, all of that kind of falls into place. And knowing what you want your experience to be like through, reading books, talking with others, and really finding that out, and just saying, sometimes in some areas, I know there's not much of a choice. So doing as much as you can on your own, and being very clear about what your comfort level is and what you want to experience with this, is important that you're able to advocate that. And some people will get, a doula to help them in the labor and delivery room. And that is great to have that kind of firsthand experienced coach to be there with you and to advocate with you. Because when you're in the midst of it, it's like, just, let's get this over with. So at least I've experienced that. I think just really having a good connection, but a lot of times our OB practices, are very, very big, and you may not even see the doctor more than once that ends up delivering you. So you're being able, to have an advocate in with you in the labor and delivery room, and knowing what you want it to look like, to walk as much as possible before you go in, to make sure that you're able to squat or have a squat bar if they have that. They have a labor ball to sit on. Do they allow that in their delivery room? Will they do the delivery in dim lights? I'm like, we don't need bright lights to do a natural delivery, and we don't need this bright light on the baby to shock its nervous system when it comes out. We don't. We can do very dim lights. And then if you know that you're healthy, do you want them to, put antibiotics in your baby's eyes, right after childbirth? I mean, if don't have chlamydia, there's no reason technically for the antibiotics that are being used in baby's eyes. And so you can advocate to refuse that. But, just like, okay, if there's question, just test me the week before I'm due or something, just do an extra test. And if the insurance won't cover it yourself, just so that you don't have to do unnecessary things for the baby either when it's born. And once the baby's born, skin to skin, right on you, it's the best thing, so the baby can start suckling right away. And breastfeeding, oh my gosh, Adrienne, I could do a whole lecture on this, because let me tell you, after 2 weeks of hell, it's really, really good and good experience. But it's really important.
So much research about breastfeeding. I had a close friend who said, I think offhand, a couple of months before she was about to have her first baby, that she wasn't planning to breastfeed. And I kind of went white. I mean, I was like, wait, what? Not because she had a complication, but just, it's a preferential thing. And I said, before you make that decision, let me send you every piece of research that I've covered for WellBe, because we do these research wrap-ups, like we used to do monthly, but they're quarterly now. And I probably sent her, I don't know, maybe 30 studies, by email. And I said, don't have to go through every single one. Just read the abstracts or the results or the whatever, but just read this before you make that decision. And she ended up doing that and breastfeeding for over 6 months, and saying she really enjoyed the experience. It helped her lose weight and bond with her child, and she changed her mind basically. But yes, I know we could talk about it for hours, yes, how powerful breastfeeding is.
And again, that oxytocin connection. And too, like, I didn't know about this with men, but the nipple shields. Nipple shields are amazing. Actually, it was just in Mind Body Green. I was interviewed for an article on nipple shields. I mean, let me tell you, I wish I knew about that, because that is game changing. It can be so helpful. But that skin to skin, that oxytocin, that bonding, and then of course the fetal development, brain development, likely to have addictions or addictive disorders, things like that. So there's so many benefits. And with that said, again, detoxing our body as healthy as we can, keeping out chemicals, et cetera, it's important. But there's no formula that imitates breast milk. There is not one. So yeah, I'm with you on that one. And not to make anyone feel bad if they don't or couldn't, but to, try, definitely to try, because also getting a better night's sleep with breastfeeding. I mean, it's just huge. I mean, I know when my first one, because I went back to work at 3 weeks. I was an OB-GYN resident. So when Amanda was born, my firstborn, I breastfed her and pumped at the hospital every day. And, so she'd have bottles while I was away, and then I would try to breastfeed. I only was able to breastfeed her for 3 months doing that. Just the milk supply and stress of being an OB-GYN resident certainly played in, but then having to switch and make bottles in the middle of the night, already sleep deprived. Yeah. So baby two, Mira, I breastfed her for close to a year. So I was like, I'm just going to keep breastfeeding you, because I know bottles are just not my cup of tea. So when you have to, yeah. But if you can, it's a gift to both mother and baby, not just for the short term, but for decades.
You said bottles in the middle of the night, meaning just making a bottle was actually more work than breastfeeding. That's amazing.
Oh, for sure.
I didn't know that.
Absolutely. The temperature, checking it, actually having to get out of bed versus roll over and grab the baby out of the bassinet and roll back over. Yeah, it's so much easier, so much easier.
Interesting. Wow. I didn't know that. Okay. That's great to know. Of course, this is very selfish in that I'm taking lots of personal notes, but hopefully for everybody else as well. I'm so glad you mentioned the antibiotics in the child's eyes, because this is something I knew nothing about and just learned about from my doula about 2 weeks ago. And then, other things like the vitamin K injections or certain, standard of care procedures that might not be necessary. Like you said, if you don't have chlamydia, there's, no reason to do it. So are there any other, standard of care practices in the birthing and post-delivery period that you think aren't necessarily medically necessary, or that people can ask about or potentially avoid? And which ones do you think are really important?
Yeah, it's a good question. And a lot of the reason that we have these standards of care is so that people aren't lost to follow up, right? Why things are done in the hospital, because they may not follow back up with their pediatrician or, their OB-GYN afterwards, right?
I thought you were going to say are for liability more than.
Yeah, and that too, that probably. But, again, it's a very natural process. It doesn't need to be industrialized in the way it has been. And I mean, I've seen colleagues who immediately put an epidural, like the woman's not even having painful cramps, but the anesthesiologist there, let's just go ahead and put the epidural in now. And then you've got to Pitocin the heck out of that mama, which high dose Pitocin can have negative consequences. I believe we're seeing preliminary research on this, which we didn't believe it could, but it could be one of those layers that can cause some maybe neurologic problem further down, or autism association, because of Pitocin is oxytocin. So, oxytocin resistance possibly later on. There's some research out of the University of Washington that has looked at this parallel between high dose Pitocin and autism. And I think it just makes sense. So we don't want to do those things if we don't have to. But I know colleagues that it's just standard process because we feel safe with the process that we're doing. And if not, label's not progressing, we have a safe C-section to do. But let me tell you, then you're committed to C-sections after that. And it's women too. Like I know I was over my due date, and you get over that due date and you're like, oh, come on now, let's get this baby out, like doing everything, strip my membranes, which we put our finger in around the cervix and the membranes and kind of strip it to release some prostaglandins to start the contractions and stuff like that. Oh, believe me, did all that stuff. But, just to induce your own natural hormones to start you in labor. So there's some fun things that we can do there. Don't drink castor oil. So don't do that. That's one that's still out there. Don't do that because you can have a meconium baby and you don't want the baby to have a bowel movement. So just, be very conscientious about that. Don't rush your due date. As long as you're healthy, baby's healthy, and heart rate variability, your OB will listen, monitor you over your due date. So like women get impatient. We want the scheduled induction, know when the baby is coming because family is coming into town. And honestly, then, that doesn't really fall into nature's plan. And so we may be doing things unnecessarily that maybe aren't without consequence. So I really want, people to think about that too. As an OB, I think those are the challenges between the art of medicine and the science of medicine.
Yes, I agree with all of that. And it's so good to hear because, of course, I'm thinking I want to rush my, anything over my due date. I'm like, get this baby out already. I feel that way. And it's, 11
I hear you.
Away.
I hear you.
You mentioned something that I just wanted to ask you. If somebody does end up needing a C-section or has an epidural or something happens and the baby ends up being in the NICU for a long time, what are the health impacts of that? And what can women do to naturally support recovery from that, both, mother and baby, when things don't necessarily go as planned, especially with microbiome support?
Yeah. Now there's the whole thing about vaginal swabbing, for a C-section is to actually take vaginal microbiome and swab the baby with that. And there's mixed research on that. Baby would be coming out that way. So I don't see that there's a negative to it. So I mean, I really don't see there's a negative to it. We used to be so sterile and swabbing out the vagina, and we don't have to do any of that. In fact, it's better not to for the baby, because the baby is seeded with already it seeds healthy bacteria to support their immune system. And we know that now based on research. So yeah, clean external environment, but not to swab out the vagina. That microbiome that the baby passes through that gets into their nasal passageways, mucous membrane, is essential for their immune system, their development. So again, healthy mom, healthy baby. And so with the C-section, you can ask for a vaginal, like a vaginal swab to be rubbed over the baby, nose, mouth. Again, that's the way that nature intended it, right? So don't get grossed out by it. That is nature. There's going to be a lot grosser things with children, let me tell you.
It's not nearly as available as I think it should be, which is sad. I was going to deliver at a very academically esteemed university hospital, which I will not name, and ended up switching because of a couple of different things I didn't like about it. But one of the things I asked about were these vaginal swabs. Should something happen, I need a C-section, and they hardly knew about it. I mean, they were sort of like, you've heard of that. And then that was it. Like it wasn't available.
And that's like where we can on our own, do that ourselves for our baby too. So that's definitely, again, taking what we intuitively, if you feel like that's going to help you and your baby, intuitively, the science is, you have mixed results, but nature intended the baby to pass through the vagina. So, and then again, the seeding of the microbiome into the nasal passageways is associated with a more robust immune system. And again, like delaying, especially with C-section, consider, spacing out vaccinations after the fact, because you want the baby's immune system to develop strongly. And, like at 2 weeks, does a baby need a hepatitis vaccine? I mean, that's a whole nother topic of conversation. But I know for me,
for another hour about
as a mom, I just did, the more I knew, I just paced out the vaccination schedule. And I just paid, I paid the extra visits to pace it out, with what we needed to do. That's just the way it is, and it's my choice to do this for my child, and I'm my child's best advocate, right? And so I think that's a really important piece that you need to understand. The second part about with a C-section, even while you've had a C-section, as long as the baby's doing good, they can give you the baby right there while we're sewing you up. And I've done that for moms that I've wanted to. And some are like, okay, I'm just too overwhelmed by this entire process. But others were like, mom, dad in the room, baby on mom's chest, ready to breastfeed while I'm sewing up. So that can be done too. And again, we can, do that without all the bright lights and noise and stuff that's happening. Feeling, that there's more that needs to be done in our training, as certainly in our academic hospitals, to allow more of a natural experience to giving birth, even in the most emergent situations. So that, it's an emergency, we have to do the C-section, but I can still, the baby's good, mom's good. At that assessment, I can give baby to mom right away. So the sooner we can do that, the better for the mom, better for the baby. And just to see the latching on, this alert, awesome child latching on to mama, right away. And then also, again, with the epidural, you can do a lighter walking epidural. Some hospitals do the walking epidural, so they're not as intense for you and baby. And, they can increase it as you need it. So something to consider there as well.
Absolutely. You've given me so many good tips of things to ask my midwife about. And then just the last question on birthing, postpartum recovery. I can't believe how many things I've read about postpartum depression or different infections coming up when things aren't healing properly, or breastfeeding being painful and not knowing that there's a fungal connection and things like that. Like there's just so little information and help to help the mother's body once they go home. It's all about, keeping the baby alive. So what are, just a couple of the critical things that you tell women when they head home to make sure they recover properly?
Yeah, definitely like this, post-vaginal delivery, the sitz baths, like just having that warm water to like sit in the bath and, or, in the toilet, you can put these little tubs, you can sit in that and just naturally, so you don't have to wipe. Oh my gosh, it can be so tender. And my first labor lasted a day and a half. So I was like torn up, right? And so that just was eye-opening for me. So having that sit bath, and you can put tea bags in there, the tannic acid in tea can help the healing a little bit more. And so that can be very soothing. Use aloe, use coconut oil. Like even a dry toilet paper can be painful. So put coconut oil on that toilet paper, blot dry, and then sitz pads. I created a vulvar cream to help women. I wouldn't do it, right while you're breastfeeding because there's DHEA in there, but to help restore that tissue and the integrity of that tissue, use Julva cream. And that can be very beneficial along with your pelvic floor exercises. But really taking care of the pelvic floor so that it heals well and properly, it will make your life so much better. And that's also with hemorrhoids. You can use Julva around your anus especially if you have any hemorrhoids or fissures. I mean, a lot of changes that can happen there. We want to restore that. And get up your vitamin D, get that good night's sleep as much as possible. Bioidentical progesterone, if you're experiencing postpartum depression or postpartum blues, bioidentical progesterone is better than any antidepressant, as is a good night's sleep. And, get the help you need. Don't have to do everything on your own. No martyrdom being a mom. I mean, cultures in France, they have someone assist you for months. In Holland, they have someone come to your home for months to assist you. Maybe do a deal with another mom or, someone in the neighborhood, a lovely teenager or college student that can come help do the things that you don't have to do. So you can just focus on being with your baby during that time and recovering your body, your mind, your spirit, getting sleep, sleeping when they sleep. And one thing that I'll tell you too, Adrienne, because, we're working women, we're strong, powerful women. And it's one thing I always would tell my patients is you will never regret the time that you choose to stay home with your child. You will never regret that decision. There's not one time. And, for me, I was back to work at 3 weeks with number one, number two, just crazy. And number three, would go to work with me, in my private practice. And it wasn't until my youngest now was 8 years old that I actually took the time. I took time off. I took the sabbatical and just changed my life around. So it was what I needed and was what they needed. And I said to myself, okay, tell your patients, you'll never regret the time you take off to raise your children. This is the time I needed to do that as a single mom now in my life. And it's just been game changing, totally pivoted my career, my life, and have been able to, help so many others that I couldn't have done in my one-to-one private practice.
Absolutely. And I just love how it took you realizing that you needed to give yourself and your children more of your time that helped you to pivot into a career space that has helped you reach so many more people and arguably would make you more busy, right? You said you had 4 children, right? Mm-hmm. 4 children, all the books you've written, all the social media presence and all the amazing free content on your website and everything you do and your programs and your products. It's really incredible. And the fact that it all comes from you needing to change things up to give yourself and your children more time is just, that's so perfect to me. It's like it was meant to be because you figured out how to do that. And a lot of people can't.
It's trusting your intuition. What's the one next right step? It's hard. I mean, like being a single mom is the hardest job I've ever had. So it's like, what's the one next right step? And then also thinking, what's right for me at this time? What's right for me and my family? And not allow myself to be pulled in a 1,000 different directions.
Yeah, absolutely. That's beautiful. Okay, well, I think we do have to wrap up. I have to let you go. Like I said, I could probably spend a whole nother hour with you on breastfeeding and vaccines and, all these things. Oh
my gosh, yes.
So maybe we'll have to have you back on the show. We don't do a lot of repeat guests, but this one I would absolutely make an exception. So one last question I have for you before we wrap up, because of your focus on it, and I think that it's helpful. It was mentioned briefly, but early menopause. This is something that you sort of, the sort of end of the fertility period of your life, and people I think the average is 52 years old or 51 years old, right? In the US for women.
Yes.
But some people, it's happening in their late 30s, like it happened to you. And since you were able to successfully reverse it, for anybody that's listening that's gone through that or knows someone who's gone through that or fears they might go through that because their mother did, what are the, first of all, root causes of it? And what can people do to make sure that that doesn't happen to them? Or if it's happening to them, how to, really reverse it?
Yeah, there are so many things that we can talk about. Really, it comes back to, getting to produce your own hormones as naturally as possible. And that comes with progesterone, the mother hormone. So everything we can do to manage stress is going to improve our hormones. Now, there are different reasons for premature ovarian failure, early menopause, and it can be autoimmune disease, it can be genetics, but that's like this very small percentage. The majority, it's toxins, it's stress, it's hormone disruptors. And when we clear that up, we detox, like I talk about in my book, The Hormone Fix, because I go through the different things that can really affect our body's own natural hormone production. And we want to keep our master hormones really, really strong and healthy. And the way we do that is supporting, definitely supporting the things that bring us pleasure in our life. Oxytocin is the most alkalinizing hormone in our body, whereas cortisol is the most acidifying hormone in our body. So as we can empower oxytocin through, pleasure, orgasm, intimacy, laughter, giving, joy, doing things we enjoy with people we enjoy doing them with, we increase oxytocin and decrease cortisol in our life, that empowers our progesterone, our estrogen, our testosterone, our DHEA, all our reproductive hormones. And so that's the shift that has to happen. And removing these toxic hormone disruptors and cleaning up our body from that way. And it's a constant process. We're constantly exposed to toxins. So there's a way we can test, and I go have a whole testing chapter. There's a way you can test your body for these things. How optimized am I? And of course, that's important at any stage of our life. I think it's very, very important pre-pregnancy. But at any stage of our life, to decrease our risks of any inflammatory conditions like cancer, heart disease, dementia, osteoporosis that we're faced with as we age. So meditation, doing things you love and enjoy, getting a good night's sleep, doing things that bring you joy, that make you happy are, again, I can't say enough about that because there's no substitute for oxytocin. There's no substitute that we can do certainly I can prescribe it for a short term, but we have ability no matter what to make it naturally. And that's going to go a tremendous way to healing all our other hormones because of its downstream benefits.
I love that. You're making me want to look up all the things that, increase oxytocin that I can do in the next couple of weeks.
I have a chapter in my book on that too. So
I was just about to say, I can't wait for you to send it. I actually haven't really read that much as far as pregnancy books and stuff, because there's just so much out there. And I think it's been overwhelming to think about which one to read and which one to read first. But I'm going to read yours first because I always like to look at it from sort of the science, medicine, biology side of things.
Classic is What to Expect When You're Expecting. I mean, that is definitely a classic, easy, quick read, and What to Expect the First Year. That's some of my favorite. Another good pregnancy book is written by Joel Evans. He's an integrative OB-GYN in New York City. So that would be another one.
One last thing about menopause. You mentioned bioidentical hormones. So you do give those to patients. Is that considered natural or unnatural? Or
bioidentical hormones are natural, but we're supplementing with something natural. We supplement with food, which is natural. So, and we used to eat nose to tail, and that way we'd be getting animal hormones to supplement our hormones, right? So I consider bioidentical hormones post-menopause essential. I consider it essential. So bioidentical progesterone, and I created a cream called Balance, which has progesterone and pregnenolone, these two mother hormones, game-changing, really beneficial. And, of course, I put DHEA and Julva. So I believe in using these bioidenticals and certainly estrogen. So we balance this out. A little bit goes a long way. We don't need to have the hormones of a 20-year-old, but we need to have, healthy, balanced, even keel hormones because we're not living in nature. We're not eating nose to tail on a regular basis. We're not drinking from streams with minerals and eating fresh food recently picked or killed, right? So that's a different energy than how we were designed in the last couple hundred years. We've really changed the way we live. So unless we're living that way, I feel very strongly to optimize our quality of life and our longevity, that bioidentical hormones are one of the keys.
Got it. Okay. I'm so glad you explained that, because I have gotten a couple of questions from women who are in menopause. If I had information on whether bioidentical hormones were really, natural, or if they were trying to do things naturally in menopause, should they take those? And of course, I don't know. Usually when I don't know something, I have a lot of research and I've, interviewed enough experts to pass along what I've learned from them. But I, really had no answer. So I'm glad now I have a little bit more information on that. Anna, this has been so rich with helpful information, both for me and I hope so many women listening and men who may be supporting a woman in their life, trying to get pregnant, being pregnant, birthing, breastfeeding, going through menopause, etc. Please tell us where, people can find you for more information, and certainly where to grab your book.
Yeah, definitely easy to find me at dranna.com, ANNA.com. And that's my website. And there's a whole bunch of free information and, lots of education there and recipes and good stuff. And my books are on everywhere books are sold. So support your local bookstore and get The Hormone Fix and my second book, Keto Green 16. For social media, at The Girlfriend Doctor on Instagram and Facebook. And we also have a Keto Green community on Facebook as well.
Thank you again. And it's been a pleasure.
Thank you.
Now, I'd love to know, what's an inspired action you can take right now based on what you heard from Dr. Anna today? Or perhaps you've already gone through and reversed a condition or symptom Dr. Anna talked about. Whatever your experience has been, make sure you leave a comment on the article version of this episode on getwellbe.com, and you'll find a link in the show notes. It's helpful for the entire WellBe community to hear your stories and experiences and know your takeaways and your insights. Also, while you're there, become a WellBe Insider so that you can get all of our latest content, special offers, and personal notes I don't share anywhere else weekly in your inbox. Plus, you'll get a free copy of my audio guide on how to feel the best you've ever felt and heal anything. The 10 things you need to optimize your health and heal any health issue, big or small, naturally. Even if you're the healthiest person out there, I promise you'll learn something you didn't know that can help you optimize your health. All right, I'll see you back here next week for another episode of the WellBe Podcast. If you haven't already and found this episode helpful or interesting, subscribe to the podcast. This way you'll never miss a new episode and they'll be delivered to you whenever we publish a new one. And please share this episode with family or friends who you think might find it valuable and informative. It means a lot and helps more people find the podcast. If you already have, then thank you so much. I really appreciate it. Once again, this is your host, Adrienne Nolan-Smith, and thanks for listening to the WellBe Podcast.